Planet Vero Studio is powered by the Nolan Group of eXp Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soulé.
Hey, and good afternoon, everyone. Welcome to Community Conversations. You know, we are just so lucky to live in paradise. And as we come into warmer weather, as we are around the Easter season and a number of different religious activities that all celebrate spring and a renewal, we were talking about little lambs and chicks and ducks. And so today we're going to talk a little bit more about the Great Duck Derby that Treasure Coast Community Health puts on every year, as well as some other current events, things that are coming up much sooner than our Duck Derby in October. So welcome back, Dennis Bartholomew.
Thank you.
You are definitely the outreach guy, the quack quack guy. I even have my little quacky here. And Colette Hyde is also with us today. Colette has taken care of so many different aspects of our business over time, but she said, I need a few minutes to bring updates to people. So that's what we're going to do for the next 24 minutes. So stay with us here. Not about an event outside yet, but Dennis, when is our next Duck Derby?
It's coming up. It's coming up in October.
Okay.
But we have to get 5,000 of those little guys adopted. Last year we had a great year. We did very well, and we're hoping for a better year this year because it's our 10th annual Great Duck Derby.
Quack.
10 years of doing the Great Duck Derby at Captain Hiram's, who have been our sponsor this entire time. So it's been a wonderful union, with Captain Hiram's and all of our sponsors. We have great sponsors for this event, and actually I'll be out knocking on doors soon with our sponsorship form. So be prepared to see me. And we're going to maybe be doing some sponsorship events at different sites, too.
Well, it does so much good for our patients. You know, we don't do galas. We don't do a lot of different fundraisers that you see around the community pretty regularly. So this is our main event, and we've chosen initially so that we could involve the whole family because all of healthcare is all about family. Okay.
It is. And this is a pay-it-forward event. I mean, you help us by adopting a duck or by sponsoring the Great Duck Derby, and it helps us provide services to those folks who walk in our door who can't afford the services that they need.
Absolutely, and we've talked for years about what does $5 do for us, what does $10 do for us, what does $200 do for us. It's not about us as in Treasure Coast. It's about the individuals that need the care. And we all have times where we're pretty flush with cash, and we go to Starbucks, we get our nails done, we might upgrade a phone. If you're experiencing one of those flush times, please think about those that aren't. $5 is as low as we could go. Although our staff have found a new way to be creative and help us, they're pitching in dollars every time they wear jeans. So if you see our staff in jeans on a Friday, it's not that we are all that casual. It's that we are, again, looking for creative ways that we can help individuals within our community.
Yes, I know. It's been working well. Our staff has been very supportive of this event. And like you said, other organizations in town have multiple events throughout the year. This is our one event. And in this time that we're in right now, with the inflation being high and gas prices are high, and everybody is worried about that, and certainly we get that. But an extra $5 to help somebody who's in need of a medical, dental, behavioral health, vision service, what a great way to pay it forward.
Well, and as you say, we've still got 6 months left. So some of our staff have already said, this doesn't hurt a lot at $1 or $5. So can we do this every week? Okay. Yes. And then that adds up. And that really is very, very helpful to individuals who need that care.
It has. It has been very helpful. So
get out on the street, talk to businesses and others, and we'll see how this works out.
I'm ready to go. I'll be knocking on your doors soon.
Okay, quack, quack. And you're out there a lot anyways. You're at Downtown Fridays. You appear at a lot of different fairs around town.
Yes.
So thank you for doing that.
And we were just at one this last Saturday, and a lot of people came up to us and wanted to know what the Great Duck Derby was.
Yeah.
And I said, you have 10 years and you haven't heard of us yet? And they said, well, we're coming this year. So,
yeah, or they're from out of town.
Or they're from out of town.
Yeah.
There were a lot of those. Yes,
a lot
absolutely.
Of those. All righty. Well,
All right.
Thanks again for all of your promotional efforts. It really is promoting that we are trying to work at creating a healthier community, and that's a team approach. So, and speaking of that, Colette,
Yes.
things are always changing. And so the new challenge is getting the word out to individuals about the most recent federal change.
That is correct. For people who don't know, the federal government, with the ceasing of the pandemic and the emergency status, some people may actually lose their emergency Medicaid. So what the federal government has gone and done is established a special enrollment period for individuals who are at or below 150% of federal poverty level, who may now qualify for healthcare.gov coverage at little or no cost.
Ah, wonderful. Because again, things have been very different in
Yes,
the
they
last
have.
2 years, and everyone is seeking normalcy, but that doesn't necessarily mean that financially they're in a position to lose their
Correct.
Medicaid and therefore the Medicaid benefits of health coverage.
Correct. So if someone is looking for some assistance with the special enrollment period, they can contact Treasure Coast Community Health, or they can call 772-464-6408, and they will get connected with a specialist who can assist them with this open enrollment period. Remember, it's valid for anyone who's at 150% or less of federal poverty level.
Now, do they have to have a certain number of months residency as they did for Medicaid?
No,
Okay.
no.
Okay.
If they're new to the community, if they've just moved here, which we do have a lot of people who have just moved into town, that also qualifies for a special enrollment period. If you move from Indian River County to, let's say, St. Lucie County, you qualify for a special enrollment period because you are now in a new county.
Regardless of this add-on
Regardless,
coverage.
correct.
Okay.
So those special enrollment periods have always been in existence. If you get married, if you have a child, if there's a death of a spouse, those generate a special open enrollment period. If you lose your job and you lose your health care, that generates a special enrollment
For
period.
how long, though?
The special enrollment period is only valid for 60 days
Okay, 60
from
days.
the actual date of the
Right.
occurrence.
Okay.
Now, this special enrollment period for individuals at 150% or less is until the end of the year.
Okay. And that's probably because although it is officially forecast to be over this month,
Correct.
there's some debate as to whether it will be extended or not. So this makes it pretty simple from now till the end of the year, regardless of when the official pandemic health emergency is done.
That is correct.
Okay.
Yes.
Well, thank you both very much. We're going to stop for a short break for word from our sponsors, and then we'll be right back. We've got more changing things that Treasure Coast Community Health would like to tell you about. So don't go away. The new year is underway, and it's time to schedule your annual physical. This quick, comprehensive visit can uncover diabetes, high blood pressure, and even cancer, ultimately saving your life. Treasure Coast Community Health waives Medicare deductibles and offers a sliding fee scale discount, so everyone can afford to take care of their health. We can't fix what we don't know. Let's work together to make a healthier community. Call us today at 772-257-TCCH. We're a nonprofit.
ITEX, or International Trade Exchange, is the largest barter company in the world with over 25,000 members offering goods and services. We're a marketing company that brings you new business in the way of trade, with over 200 local members enjoying the benefits of ITEX, like lawyers, doctors, plumbers, media, printing, and more.
Hi, this is Liz Bowler. Contact me and find out why barter through ITEX has been smarter for over 30 years. 772-532-1881. Visit itex.com.
You can trust Sandpiper Pest Control, serving Indian River, St. Lucie, and Brevard. Certified by the state of Florida to treat homes, lawns, and termites. Fully licensed and insured. Priced right, effective, and friendly.
Hi, this is Joel, the owner of Sandpiper Pest Control. Sandpiper can solve your pest issues. No contracts to sign, just results.
Call for a free estimate, 772-589-0204. Sandpiper Pest Control, a member of the iTex trading community. Your iTex dollars are welcome.
Water service? Don't let your money go down the drain. Make sure to get a quote from Affordable Water. Many times, Affordable Water's original price is less than the competitor's discount price. Yes, Affordable Water really is affordable. Make sure to get a quote today, because you haven't gotten a quote until it's affordable. Affordable Water.
Call 589-7677 or you reach 20. Call the Pure Water Pros. Affordable Water.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soulé, and I'm the CEO of Treasure Coast Community Health. We provide primary medical, dental, behavioral health, pharmacy, x-ray, lab, you name it. We look to fill the gaps of all of your healthcare needs from cradle to, well, old age. We welcome new patients. Those of us that are established patients also have the advantage of being able to make a same-day appointment. You wake up and you're not feeling so hot, and you think, should I go to work? Maybe I should go to the emergency room. No, give us a call. Let's take a look and see if we can't get you back on the road to feeling great at 100% right away, same day. We are a team-based care. That means that we have a provider, usually a physician, but sometimes a nurse practitioner with lots of experience, and they are supported by nurses and medical assistants, pharmacists, and other folks who help with things like referrals and, like Colette, the financial end of things, so that the care is really a wraparound process. And so if you would like any of those individual concerns addressed, including behavioral health, we also have medication assistance for those folks that are struggling with substance use disorders. So give us a call at 257-8224. But having done that very long promo at the beginning, let's talk about some of the new things that we've been adding. Dennis and Colette are both familiar with our new Vision program.
Yes, what an amazing opportunity that we've now opened up to the community again, especially for children, for folks with diabetes. So it covers all age groups. Anybody who needs a vision care is certainly welcome to come to us for a service and talk to Colette about how to make that happen.
Well, the first step always with us is to see a health navigator. A health navigator will assess the household situation, whether you're single, whether you have a family, and then from there, we'll do a financial assistance piece, what we call a simple slide, on that individual and see where they qualify and what type of discounts they qualify for. Very important that when you come for your appointment with your health navigator, the reason I'm wearing my glasses is because there's a list of stuff you need to bring. And a lot of times people don't always bring everything they need, so it delays us being able to offer the simple slide to them.
Especially the medications that they need. People forget to bring in what medication they're on to show the doctor or the dentist.
They do.
And then all of a sudden everything is on pause because what medication are you taking?
Yeah, we want to make sure that we stick with what works for you. As you say, we have a lot of folks that are moving in from other counties, other physicians, and so we want to make that transition as seamless as possible.
Correct. But when they do come in for their financial assistance piece, they need to bring in their household income. That's very, very important.
Everything.
Everything. That's right. So if mom and dad are both working, then we need income from mom and dad. Don't just come with mom's income and say, oh, I don't have my husband's income. It has to be household. Okay. If you've got, we also need to have proof of residency, which means any kind of bill you get, any kind of mail you get.
Except occupant.
Except occupant, correct. No, nothing that says occupant, right.
It's got to have your name on it.
Yeah, no, it has to have your name on it, obviously. But we get enough of those nowadays.
well,
Everybody knows who's living in what household.
Yep.
And so if you bring in 2 forms of proof of residency, that also expedites the financial assistance
Does
process.
one have to have a picture of you?
We do need a government-issued ID, whether it's a passport, whether it's an ID card, driver's license, it does need to be a government-issued ID. That is a requirement of the program.
Okay.
But typically, if someone doesn't have an ID, there are ways to at least assert that that person is who they are.
Okay.
But we try to at least request that from everyone.
And is it the same with income? Because sometimes if you've been laid off, you may have leaned on other people for support. If you come in and say, I didn't make any money at all during the whole year, it's like, well, how did you feed yourself?
Right. We have special forms for individuals in those situations. One is called a letter of support if someone has actually been helping to take care of you.
Okay.
Others are, some people actually work cash jobs, so they don't have any pay stubs per se. They can do a self-declaration of income. So there are forms, acceptable forms that are used to at least expedite getting them the financial assistance that they need.
And that's so important because, again, we know that cost is a concern to many people. How am I going to ever do this? I'm here now, but I'm not coming back.
Right.
And that's not what we want to have happen. As I've said to more than one person, it took you 3 years to come to us. We can't fix you in one visit, so it really is.
Absolutely. And like this morning, I had a gentleman, he's 67 years old. He makes $1,000 a month in Social Security. He chose not to take his Part B because he says, I can't afford the copay, the $170 a month. Mm-hmm. And I was like, okay, there are other things that we can do to assist you here. One, we can get you into an Advantage plan, which doesn't cost anything to you, so you don't get that Social Security deductible every month. And because your income is so low as a single senior, you qualify for QMB. So let's come back in and get you. QMB is a qualified medical assistance program through the state of Florida, through Medicaid. Okay. So when we have seniors who are Medicaid, Medicare, it's because they're low income. So for this gentleman, as I was going through his application, I literally got on the phone and said, we need you to come back in because there were a few things that I don't think were offered to you that we need to follow up for you.
Now, does everybody who comes to us, even if they have insurance, sit with a health navigator to start with?
If they have insurance, typically not. We encourage everyone who doesn't have insurance to sit with a health navigator. The only reason why someone would sit with us if they do have health insurance, if they have a special household situation, or they don't have insurance for dental. Let's say they have medical insurance but do not have dental. Then we would want to sit them down with a health navigator.
I had that exact scenario happen to me on Saturday. A person asked me about, I have medical insurance but not dental insurance. Right. What can you do for me?
Exactly.
So I gave them all their stuff.
There are some specific programs that will help and assist individuals that way. So it is a good idea for them to come in and sit with a health navigator.
And we're very grateful that we live in this community because the hospital taxing district, which collects property tax money specifically for people's health concerns, do help us with the cost of the care for those individuals. And so it's a win-win all the way around. Of course, the cost of care always seems to exceed what we've got coming in, whether it's from the feds, the state, or the hospital district. So again, coming back to the duck derby, it's not like we're sitting around eating bonbons saying, boy, we got all this money rolling in.
Exactly, like our Think Pink program,
exactly.
It's like this is a mammogram program, and within the first 7 months or so, that program's out of money.
Gone.
Yeah.
And then there are still people who need the service, and consequently, when you adopt a duck, some of that money goes into that pile so we can help people get the services they need. It's not like Vicki said, we're not eating bonbons with this money. We're serving the community. The money goes right back to the people in this community who need it.
But just like you appreciate your sponsors for these events, we truly appreciate the fact that there's only 8 or 10 communities across the state that have hospital taxing districts. And there's nothing that says that they have to help in a particular way with a particular expense. Up to this time, half of those dollars that were collected went to the hospital until Cleveland Clinic exceeded their 3-year new venture here and permanent and all of that. So we're very grateful that the hospital district chooses to fund so much of our homeless population
Absolutely.
here.
Because we see an incredible number of people who really are in need. And without the financial assistance from the Indian River County Hospital Taxing District, I don't know how these poor individuals would get medical care. But on a good note, we have some new providers, don't we?
Yes, we do.
We have some good new providers. I believe we have a new provider who just started with us who is going to be providing wound care.
Yes.
So I'm going to turn the table on you.
Okay.
You can tell us about her.
Okay. Well, this morning we had an orientation of new employees, and we have 2 new registered nurses and 2 LPNs. And one of those registered nurses, Brett, is a certified wound care specialist. So he's adding to our cadre of specialized and certified individuals. Wasn't a whole year ago that Colleen Shemansky joined us as a certified diabetes educator.
Yes.
I was like, what? What's my brain doing? And so Colleen has been working with our diabetics and pre-diabetics, working to help them get back on track, perhaps stop sticking their fingers and get a device that will monitor it internally.
Constant glucose monitor.
Yeah, constant glucose monitoring, glucose insulin pumps, the things that make life easier, because it is their entire life. It's not like correcting eyesight. Maybe someday it will be. But for right now, if you're a diabetic, you're a diabetic for life. And so trying to make life easier for those folks is really important to us. And so Brett will be adding into the cadre, helping folks take care of their wounds. We do have a group in town over at the hospital that does wound care, but again, they don't have quite the same ability in terms of bringing people in for a comprehensive visit as we do. And so we're very excited about that. And we just had Jerry Yang, a physician assistant, join us. And next month we have another. You guys must have run into Jerry.
We know Jerry
several times.
Okay.
We've run into Jerry several times.
Well, that's wonderful. He used to be here in town in a different organization. And so we're very pleased to have him on board. And Tiffany Benson, a women's health care specialist who also sees young children, pediatric age, will be joining us next month. So as the need continues, we're trying to be responsive to that need. And so we're very excited to be able to say again, if you need care, give us a call, 257-8224. We'll be there for you, the entire team.
Right. And I understand we're also expanding or beefing up our Suboxone Medicaid assistance program.
We are. We have a number of people who need to get off of street drugs because, as we hear over and over again, the fentanyl overdose is just, it's tragic and it doesn't need to be. So trying to get folks into both counseling and some medication-assisted treatment so that they can wean off in a safe, secure way, stop the chatter in their brains and get back on track to the life they want to have instead of where they're at right now. So again, if you know of someone, whether it's opioids or alcohol or anything in between, please give us a call. Identify that you want to talk to our behavioral health group, and then specifically that you're looking for some medication-assisted treatment, and we'll get you squared away there too. Thanks.
Right. So our programs have really grown over the past few years. I know when I started, we had medical, dental, and some pharmacy. And now we've gone to medical, dental, pharmacy. We've got BH. We have vision, the Suboxone, and the medication-assisted treatment.
And the pharmacy assistance program for things like hepatitis. So again, if you find yourself in need, give us a call. Can't say it any more simply than that. They're great services. I go to our own providers, as does all of my family members, and most of our staff do as well. You can't get more trusting than that. So We've looked behind the curtain, and Oz is there. So again, thank you so much for staying with us this time. Next time, we'll have some outsiders in, and can't wait to have you back in our living room, so to speak. Have a great night yourself.